Kenya has today joined the world in commemorating the World Kidney Day. In Kenya, about 5 million people suffer from chronic kidney disease.
Many of our people are going into renal failure because of those over-the-counter medications.
Avoid herbal medicines as well, because those have been known to cause kidney disease.
About 12,000 kidney patients require dialysis in the country. However, according to the National Social Health Insurance Fund, only between 400 and 600 patients are dialyzed every year. The Renal Patients Association of Kenya has attributed this to late diagnosis, societal misconceptions, and the cost of treatment.
When you're living with a transplant, you procure medicines before food.
This is why many patients opt to undergo dialysis and not kidney transplant, as the latter is not paid for by the National Social Health Insurance Fund. About 200 Kenyans are transplanted every year.
Why would I pay $400 a month after transplant when NHIF is paying fully for my dialysis? That's a question that I get a lot from my patients.
The price of some of the drugs we take, and that is those living with a transplant, like myself, has doubled in the last 3 months.
The cost of post-transplant treatment is not the only challenge, making patients shy away from the procedure.
Lack of donors. We have only 5 hospitals in the country doing transplants.
If we can deal with the immune system of the body, we can be able to transplant nearly everyone by getting kidneys from the majority of people who get buried with their kidneys, and there is nothing they can do with their kidneys in heaven.
At the same time, children are at risk of being misdiagnosed, particularly at primary health facilities, due to lack of special expertise.
The first thing that the nurse, the clinic officer, because they're the gate openers, they'll think about pneumonia, and they'll think about malnutrition.
When one's kidney is damaged, activities such as red blood cell production, bone health maintenance, and blood pressure control in the body are affected. It is therefore important for Kenyans to get tested frequently to know their situation early. Ben Kerera, K24, Nairobi.